he won't sleep until this fight is won. And that's true of many of these folks. Can I tell you one other thing? I talked to these doctors. I said, you're coming to Florida, beautiful, sunny Florida. I said, let's find a place to go relax. Dr. McCullough said, John, I don't want to relax. We're in a fight. This is a war. I don't want to relax. We're fighting. And they're great fighters. So Richard, Urso, Dr. Urso, come up, close us out tonight. We're going to have a Q&A session, so if you got some questions, we're going to do that. We're going a little long, but I hope you all don't mind. Thank you, Dr. Urso.
Thanks, John. That was fantastic. I feel like he closed it out. What do you guys think? Which such good news. It was hard for me to smile, actually, hearing that great news about the mandates, because we really can't have that happen. We really can't be dictated to. This great free state of Florida, you cannot dictate to people who live in this state. And you got a great governor. But I'll tell you, unfortunately, that's not the way it is everywhere. You know, I just got back. As John said, we've got to take this to every state. And we have. And that's what we're doing. And so this is probably about stop number 8. But this is different because Florida, a little bit like Texas, is free still. And, you know, I've got my cowboy boots on, so anytime I need to, I can click my heels and get back to Texas. But John brought up some things. Basically, my background is in wound healing scarring. I did 9 years in a lab. I invented an FDA-approved drug. So I've got not only repurposed drugs, but I found it was very difficult. And when I went out in practice, I decided that repurposing was a lot easier. And there's a slide up there. I was going to kind of show that basically what I found here, my current regimen for Delta is basically like the kitchen sink. And I'll go through that in a minute. But I want to kind of get back to what I first said. This is not about a virus anymore. Does anybody think this is about a virus? No, it's not about a virus. It's much more than that. As you see, has anybody seen what's happening in Australia? Strong Cities Networks. Anybody here know about the Strong Cities Network? Strong Cities Network is a network of cities, including places like Houston and Dallas. They've signed up to allow mercenaries basically to come in and lock down our cities if we need to. Melbourne is one of them. Strong Cities Network. Read about them. They sound really nice. All you have to do is look at Melbourne and you know who they are. They're going to lock us down. This is not about a virus. This is more. That's why they're going after our kids. And right from the start, there was a coordinated attempt. As I said earlier when we were on the panel, it's like we've always shared information as doctors. It's always been shared. The greatest people I've ever known that I grew up with and love so much were my fellow doctors. They always shared information. They were my best friends. And I don't know what happened this year. It shocked me in the beginning when they were saying that we should go home. And I'll tell you, it was pretty frightening early on. I was talking to somebody earlier about how it was last March. And I basically looked at this starting in February and found about 9 or 10 different things that might work. A lot of them are on this list. I don't know where it is, but basically almost all the drugs on that list stop inflammation. As I said, it's a biphasic disease. I talked about it earlier. It's a virus early, it's viral particles late. I say cars early, car parts late. Nobody dies from the cars, they die from the car parts. They're dying from the inflammation, they're dying from the blood clots. Our job as doctors is to try to decrease the amount of viral load so that we'll have less inflammation and less blood clotting. So it's one of the things as you treat, less inflammation, less blood clotting. That's our job, right? And a lot of the things that are on that list, which I guess keep disappearing, are anti-inflammatory and antithrombotic. But a good number of them, surprisingly, a good number of them are antiviral. And I would say ivermectin is considered a wonder drug, but a lot of these are wonder drugs. I took azithromycin. I've been using that for scarring for 20 years. 20 years. Ivermectin itself, I've been using on the surface of the eye for oil gland dysfunction for about 16 years. Hydroxychloroquine I've been using for dry eye for about 30 years. Fenofibrate, I've used that for neuroectodermal tumors. My background, I was a chief in orbital oncology at MD Anderson Hospital, so I have a big oncology background. So I was going to tell you that a lot of these drugs have wonderful effects on many different things, besides what we knew, cholesterol and things like that. That's not what the only thing they do. They do a lot of other things. And so we kind of think things are in a box, but they're not in a box. And as a scientist, you're always thinking outside the box. And that's what we expect from our NIH, our CDC, our FDA, but it's not happening. As you'd heard Pierre talk about earlier, they're captured. There's no creativity there. But I can tell you underneath the top political people, there is actually. So I have to take that back. If you talk to people underneath in the lower levels in the NIH, the CDC, and the FDA, those people are incredibly intelligent, they're incredibly bright, but the political messaging is horrible, as we all know. There's no reason to have a guy like Fauci saying what he says. I mean, he's so duplicitous. It shocks me all the time how often he says what he just said. We should vaccinate our children. This is insanity. So, as we said, John and others have mentioned, we come here not as one doctor. That's how they attack us, one at a time. But we're not one doctor. We are the International Alliance of Physicians and Scientists, 13,000 strong, to represent the truth. And I'll just kind of repeat it because I think it's really important to say. We have 3 unassailable positions that we know they have no chance of actually being able to prove this wrong. It's impossible, right? Do not vax our children. Do not. They do not get this disease. They do not die in big numbers. There is no reason. This is not an emergency for children. Stop vaxing our children. And for those of you who haven't seen it, brownstone.org, it's been compiled primarily by Paul Alexander, who's here. Paul, thank you for doing such a great job. The COVID Recovered. He's put all this material together, so if anybody asks you about the COVID Recovered, that material is there. 106 studies now. Stop vaccinating our COVID Recovered. Immunity, natural immunity is important, and natural immunity is what we create for herd immunity in the long run. That's going to stop the pandemic. And this one, I think Dr. Malone said this last week. We had a Reuters representative, the Trusted News Network. Does anybody know about the Trusted News Network? Does anybody trust the Trusted News Network? So it's a network that basically they've created to, originally, I can't remember what the original thing was, but they've used it to lock down on our speech. They've locked down on our science. That's what they've used, the Trusted News Network. They're hunting doctors. They're hunting physicians. They're hunting scientists. They're stopping life-saving treatment from happening. So if I say this, right, what proof do I have? Do I have any proof? Can I just say that and there's no proof? Has anybody ever read The Lancet? Has everybody ever heard of Harvard? Has Harvard put together a massively fabricated study in The Lancet? Does anybody know about that? Raise your hand if you know. If you don't know, raise your hand. I need to know that. How many people have never heard this? Okay, good. Last year, hydroxychloroquine was taken off. And hydroxychloroquine, as everybody knows, hydroxychloroquine is an incredibly dangerous drug, right? I'll tell you how dangerous it is in a second. But The Lancet put together in a study from 2 Harvard CV guys, the head of Harvard CV who never saw a single COVID patient, put together a study with 671 hospitals, 6 continents, 93,000 patients, completely fabricated, completely. Put it in the Lancet, said, stop talking about hydroxychloroquine. You just need to stop right now. It doesn't work. It's massively killing people. That's what they said. Most of us looked at it and said, there's no way. You cannot put together a study of this magnitude in 2 months. It's impossible. Especially they were saying they were going to Harvard, and they were going to Africa and other places where we know they can't upload things to a cloud. And hospitals don't do that. They don't upload stuff to a cloud. And we don't have just one operating system. We have multiple. We knew right away it was a fabrication. And they eventually retracted that study because it was a complete lie. And let me tell you how bad it was. They actually had there's 4 people. One was a science fiction writer and one was a topless dancer. They're disgusting in every single way. And if you think that's not a fact, that's a fact. All right, that's a fact. What did they do next? Many different things, but let's go to the ivermectin one. Right? You heard Pierre talk about it today. It's a horse dewormer, right? I mean, this is one of the wondrous drugs that we've ever had. It's saved who knows how many people, 3 billion patients, almost 0 deaths in its entire usage, almost 0. One of the safest medications on the world's list of most essential medicines, along with hydroxychloroquine, by the way. So these drugs, they've massively attacked them. And why have they done it? As we talked about, regulatory capture. The agencies are captured by the entities they're supposed to regulate. The big pharma, Pharmageddon, Pfizer Permanente, that's who we're fighting. I forget what else I was going to say. Oh, yeah, hydroxychloroquine. So does anybody want to hear about the side effects of hydroxychloroquine? You want to see? Thank you, Robert. So these are all the terrible side effects. It lowers your cholesterol. It lowers your glucose. It lowers your hemoglobin A1C. It decreases all the inflammatory markers, D-dimer, sed-rate, C-reactive protein. It decreases the risk of stroke, heart attack, and pulmonary embolus. It decreases chronic kidney disease. It improves your bone health. It decreases atherosclerosis, and it decreases insulin resistance. There are now, go pull this up right now, clinicaltrials.gov, hydroxychloroquine in cancer. There are now 96 trials going on worldwide for its effects on cancer. That is a dangerous, dangerous drug. So, I want to kind of talk about, you heard earlier, and I don't mean to digress, but I didn't hear this said, and I want to say it. Does the vaccine stop transmission? Does it stop infection? So how can it create safe schools? How can it create safe workplaces if it doesn't do that? Right? That's impossible. So where's the science? Where's the good science? It's kind of like masks, right? Do masks work? Masks work. R99, R100, PAPRs, hazmat suits, those work. They do. I worked in a viral lab. They work. I promise you. But all those masks, cloth masks, surgical masks, 0, 0, 0 randomized controlled trials in the last 4 decades that they work. They don't work. I'm sorry. I usually say this is something that it's real important to understand the optics, right? So when I talk to politicians, and I've talked to a lot over the last year and a half, you have to think about what's politically acceptable. And I've had the same conversation over and over. You're not going to win. The science is there. They don't work. But it's so much like protection. And I talk when I have my kids, I cover their feet at night, right? Because there are ghosts in the house. There's goblins back there. And we cover their feet because they're scared, right? And that's how a mask is. So, I wanted to cover, somebody else has covered this, but hospitals have become prisons. And my father, and I said this last week, my father passed away in the hospital last year with COVID. And I never got to see him. And it was pretty sad, actually, just thinking. And I mean, I know my dad, I know if he could have been talking to me at the time, he would have said, hey, I'm okay, don't worry. God's going to take care of me, it's okay. Like, don't run to the hospital, don't get in trouble. I'll be all right. So I know words were echoing in my mind about what to do because I wanted to go in and I wanted to participate and see him, hug him, comfort him while he was going through this. But no, I couldn't do it. And this is sad. We've allowed this to happen. And think about it. Now we're a year and a half in. And this is what's happened to our humanity. I mean, we are actually allowing people to go in the hospital and die all alone without their family. We need to stop allowing this to happen. I don't even know how to stop it, but it needs to stop. So we have all these wonderful things that are happening, right? There's new drugs coming out, remdesivir, molnupiravir. You heard the new drugs. So if you are in oncology, right, these are nucleoside analogs. They stop replication cycles. Does everybody know that's what they do? So you stop replication. Does that sound like a good thing maybe if it's your own body replicating? So let me go through a few things. They're giving remdesivir in the hospital when it can't possibly work. Why is that? Does anybody know? Why can't it work? The virus only replicates for 5 to 7 days. Last year, the virus wasn't cultured past day 8. All right? How could it work? Has to be replicating. And they're giving it in the hospital. This is criminal. This is criminal. To give a drug that has no chance of working is criminal. Did anybody in here realize that the virus isn't replicating day 15 and 20? Did anybody not know that? Probably most of you, right? You wouldn't know. The virus doesn't replicate. It stops replicating. That's why I say cars and car parts. Nobody's dying from the virus. The virus is gone. You cannot culture virus. You'll get little particles. That's why they're PCR positive. People will be PCR positive sometimes for 2 months. But I consider those to be, in a sense, particles are almost like pieces of a dead vaccine. They're not going to actually, they're going to create a reaction, but they're not going to kill you. They cannot replicate past day 8. So when you are giving remdesivir in the hospital, it is criminal. All right, Ben. I appreciate it. Ben says arrest Fauci. Does anybody want to arrest Fauci? Okay. Well, I'll let the Lord take care of him. But these are mutagenic agents, so just let's go through it. They kill viruses, they kill bacteria, they kill cancer cells, and they kill us, our hair, skin, or nails. That's why we pulse a lot of therapy, because highly replicating things are going to be killed by these mutagenic nucleoside analogs. That's what's happening. These are the new drugs, the same kind of drugs we've had from the 1950s. So as I have a little problem, the creativity of these companies, they're not very creative. They, instead of like trying to make another analog of ivermectin, which would be incredibly safe and long-acting, I might live with that. But instead they're going to come up with something that's going to cause mutations in our own body. So I think I'm supposed to be talking about early treatment, but so let me go through that. So you have infection, inflammation, and blood clotting. And so what you're seeing up there is that we figured this out really early on. This is back in February. We were hearing this all the way back then. So we were pretty excited that we might have a chance to basically tampen on this pandemic with treatment. I won't say early treatment, treatment. I don't know when a patient's going to come in. I don't know if they're going to come in at day 10. I don't know if they're going to come in at day 1. They come in, they're sick, I'm going to treat them, period. So we have all these drugs. And at first, it seemed pretty easy last year because we had the alpha variant. And we give a couple of agents, steroids being one of them. And Pierre Corey got massively attacked after saying steroids were helpful in April for saying steroids were great. Well, it's an inflammatory disease, so of course steroids will work. But we were using a lot of hydroxychloroquine. And then we started a chat group about ivermectin. I saw an attorney in here, Jay Sanchez. He and I and others grouped together. And so a study was done here in Florida, in Broward County, by John Jacques Ratcher. John Jacques Ratcher put together the first United States study on ivermectin. And we tried really hard to get that message out. And it was impossible. No one would publish it. I went to the White House with it and talked about it, along with hydroxychloroquine. Luckily, they didn't throw me out. And we just could not get anywhere with it. I was told, look, we can't go forward unless you have data. And of course, it couldn't get published. Eventually, it did. And then, as you know, it's been a massive help to us. But this has been, it flew under the radar for a while until Dr. Corey went to the Senate, and his testimony sparked everyone in the nation to use ivermectin. But I can tell you, many drugs work, not just ivermectin. So I can say on this list that I had up here, you can take any 2 drugs, maybe even any 3 drugs up there, and we could still treat you and be successful. You can take any of the 2 or 3 of those drugs off there, and we can still win, because it's primarily an inflammatory disease. 7 of those drugs up there actually affect the viral replication. And as you heard Dr. Malone say, even celecoxib, Celebrex is affecting viral replication. So we have a lot of things on that list that affect viral replication. They affect inflammation. Almost every one of those affects inflammation, and half of them affect blood clotting. And that's why we call it, as Dr. McCullough has called it, a sequential multi-drug cocktail. It's not just one thing. We don't just need ivermectin. We don't just need hydroxychloroquine. We need a sequential multi-drug cocktail. That's how we get it done. And this is through a small group of doctors. We've literally had probably 400 or 500 worldwide that are on a thread that work together and talk together every single day. And as John said, most of us aren't sleeping. Why? Because we know we have to stand up. If we don't, who's going to stand up? Who else is going to explain the science? Who? So, this is a tagline that we've kind of developed about this is think globally, but act locally. So you're a free state. And don't take it for granted. It's not going to last. All you have to do is look around the world. It's not going to last. They're going to come. They're going to come to Texas. They're going to come to Florida. We need to organize. Don't trust your local unions. Everything that our school boards, everything that we take for granted, every organization that we take for granted. So the action plan is, do not trust any of the organizations that are currently representing us. They won't do it. Even our state legislatures, many of whom we love, we have great governors. We can't just trust them. We have to do it ourselves. We have to organize ourselves. So that's kind of the plan. If you are part of a work environment where you have 100 or more people, organize. Get together in groups and start organizing now, okay? Same thing, pull your kids out of school. And I think that's the message. If we just sit here and just clap, we won't win. We've got to be active. And I can tell you right now, I see the age of the group in here. We grew up in a free society. The people in this room grew up in freedom. And we know it, and we're not going to let it get by. We are going to fight. I guess I'll end it on that. Thank you. I want to just add in, our kids aren't going to be able to do it, okay? They're looking, okay, last thing. They're looking to us for leadership, I promise you. Your grandchildren and your children are looking you in the eyes for leadership. Stand up for them. Show them what you have. Show them your heart. Show them that you love God. Show them you love your country and you love freedom. Thank you.